Welcome to our statistics learning session. Today, we'll be going through some examples of parametric hypothesis testing. We'll specifically dealing with the clinical trials. We have seen this kind of examples before, but we'll go through this one more deeply. We'll talk about how to build the test when there are two samples involved. So let's dive in. We'll talk about a pharmaceutical company. These days, the bulk of hypothesis testing is done in pharmaceutical industries because they have drugs and they want to improve a drug, or they are trying to produce a new drug. For those reasons, they are always doing some hypothesis testing. In this case, we are looking at a drug and we are trying to see if new drug is efficient, and it is being done by pharmaceutical industry. In this case, they are administering a drug, a group of patients, and these are called test groups. And other group which they have recruited for this experiment, they are called control group because they are not giving the real medicine, but they are giving placebo. And we have these two groups now. One group is used as a benchmark. The placebo group will be used as a benchmark, while again, and the drug given group will be tested against this benchmark. If you remember, in one sample test, we are usually comparing, have only one sample, and we usually compare with some benchmark. Maybe it may be a established guideline by a CDC, or maybe it is something printed in a newspaper. But here we don't have any benchmark like that. So we are creating our own benchmark by giving a placebo to a group of recruits and using that as a benchmark, and using another group as our test group. Here we are looking at a very specific group, type of drug. It is supposed to lower LDL compared to the placebo. And question arises, why do we need this control group in this case? We need control group in this case because whenever people are involved in a study, they become more self-conscious and they do more exercise, they watch what they're eating, and they start being more aware of themselves. That's why we have to make sure that we account for all those environmental issues when we are doing this kind of test. That's why we make sure that we'll make them all assume that they are everybody is under giving everybody is being given the medicine, and no one knows that even is being given a placebo. We have to make sure that there is no, we really have to keep it secret. We cannot make other people aware that they are giving either placebo or they are giving the real medicine, to control for these kind of situations. And also, you cannot put people into this kind of program without being aware of them that, oh, they are being given certain kind of drugs. And in this case, what we have is we have LDL and we have a medicine that lowers the LDL, which is also known as a bad cholesterol. And when you have a cholesterol more than 200 mg per deciliter, then it is called high level of LDL. Now, moving on to the second slide for notation modelings. Here, delta D, what does it represent? It represents the decrease in cholesterol for those group of people who have used drugs. I'm continuing for next slide. It is called notation and modeling. In this slide for notation modeling, we'll talk about some notation that will be used in our test. The first notation is delta D. What is delta D? Delta D is expected decrease of LDL for a patient that have used a drug. It is measured in milligram per deciliter. Secondly, we have this something called delta C, and delta C is expected decrease in LDL for patients that have used placebo, and it is also measured in milligram per deciliter. It should be equal or greater than equal to. Now let me give you an example. If the cholesterol goes from 230 to 180, then delta is 50. That's how delta is measured. Now, as a pharmaceutical company, I want to know whether delta D is greater than delta C. That's what I know as a pharmaceutical company. How are we going to do this? How are we going to find this out? As a pharmaceutical company, I have to start by recruiting people for an experiment, and then we'll be conducting some experiment on these people and we'll collect the data. For some of these people, we'll administer drugs, while other people will administer placebo. Now, let's say people who for those people who we give drugs, this is called test group, and they're identified by X1 through Xn, while people who give placebo are marked as Y, and they range from Y through Yn. This group, number of people in this group doesn't have to be same. In reality, it is very hard to make them same. Usually, the group N is larger than group M because people want to get treated. And that's why group N is usually larger than group M. But they are in same order. They are not exponentially large, but they are in same order or same ballpark. But they are not usually same. Now, what is the distribution of X and Y? We have made an assumption that X and Y are in Gaussian distribution. That's our assumption. Therefore, X and Y have their own variances, which is XD and XC. Sigma D and sigma C square. Those are the variances of X and Y. And what about expected mean or expected value? For drug, we have expected value as a delta D, and for placebo it is delta C. And this delta C belongs to group of what is called control group. In a summary, we have created a model, a notation and model for our test. In end, let me quickly summarize what we discussed today. We talked about hypothesis testing or parameter based hypothesis testing, and we took example of clinical trials where this is mostly prevalent. We took example of pharmaceutical company that wants to test whether their new drug is efficient at lowering the LDL. So the company recruited a bunch of people and gave them and divided them into placebo group, divided into control group and test group. For test group, they gave the medicine, and for control group, they gave placebo, and they used control group as a benchmark to make sure that whether their drug has some effect to lower the LDL. And as far as notation goes, we use delta D as a notation to identify the decrease in the LDL for test group, while delta C is to identify decrease in LDL for placebo group. And we assume that X and Y, which represents drug test group and Y control group, are Gaussianly distributed. So that much for today. I will see you next learning session. Thank you so much.